In order to analyze them more correctly, of course, you have to divide them into these broad categories and localize them broadly. So over here on the left is an example of a central linear defect, or what I would categorize as a central linear defect. In the middle, even though you can see this teeny linear defect associated with the vascular channel, that would still be classified as normal under the system that Karsten Stasek has described, in which if the defect is less than a millimeter across, he considers that a normal infundibulum. And then over on the far end, we have an example of this cemental hypoplasia at the apical aspect of the infundibulum. And then they were grouped as far as location was concerned as well, either apically in the mid portion of the infundibulum or occlusally. And as I kind of expected, 71% of the teeth had these visible occlusal caries, of course tending to be grade 1 caries as opposed to the more severe 2 or 3. The kind of surprising thing as well, though, is that 93% of them had these cemental defects on CT scan. So whether they had caries or not, quite a few of them had defects deeper in their infundibulum. As far as central linear defects were concerned, they were the most common defect that you would find, then cemental hypoplasia, and then combined sort of linear defects with this hypoplasia at the apex. As far as rostral and caudal infundibuli were concerned, it's a bit different than what's been reported before. The rostral infundibulum has been reported to be more commonly affected, and what I found that there wasn't a significant difference between the numbers that were affected. However, the rostral was more severely affected than the caudal infundibulum as far as carie grade was concerned. The rostral infundibulum was also slightly shorter than the caudal infundibulum, even though that's statistically significant. It's still only 2 millimeters. And as far as associating this then with the more recent research that's come out just in the last couple weeks as well, the vessels, those lateral branching vessels, have been shown to approach the infundibular apex further in the caudal infundibulum, meaning that there's more of a blood supply deeper within the caudal infundibulum than the rostral in teeth before they erupt. So that may be related to this as well. As far as caries were concerned and the length of infundibulum and age, trying to associate everything in this study, the length of infundibulum was associated with both the presence of caries and the caries grade, showing that as the infundibulum got shorter, the caries actually got worse. The infundibulum becomes significantly shorter with age. That's been shown in multiple studies. However, the prevalence of caries didn't differ significantly with age, which is a bit confounding. Central linear defects are most common in the teeth of young horses when you're talking about what kind of defect is present. And cemental hypoplasia at the infundibular apex, however, wasn't any different between age groups. And this is kind of what gets interesting in particular as well, is that if occlusal surface caries are present, it's very likely that the entire infundibulum of the tooth is affected. So 85% of infundibuli with caries have a cemental defect at the apex, no matter what the grade of the caries is. But it's still interesting to note that a majority of teeth, 60% of these infundibuli with no evidence of surface caries, still have cemental defects at the apex. So really, when we're talking about what's normal as far as infundibular cementum is concerned, not having complete cemental fill is actually the norm. As far as comparing caries on the surface and trying to predict what's deeper within the tooth, if you have an infundibulum with visible caries, you tend to either have caries at the apex or central linear hypoplasia at the apex. Interestingly, teeth with no occlusal surface caries are more likely to have cemental hypoplasia at the apex than anything else. There's also a significant association between worse caries having more significant defect at the apex and having caries at the apical aspect of the infundibulum, which can be expected. And then teeth with grade 1 caries are more uniformly distributed in what kind of defect you can expect to find at the apex of the tooth. And as you would expect as well, Trident 09 is significantly more affected by any type of cemental defect, caries, and cemental hypoplasia than any other tooth in the maxillary arcades. And there's no difference, though, between these linear cemental defects in the trident position of the teeth, which would make sense as well, since all of them have that central vascular channel during development. So as far as central linear defects are concerned, younger horses are more likely to have them than older horses. And this shows why feed material may become deeply impacted into the teeth, whether they're affected by severe caries or not, and no matter what the age of the horse is. It's not statistically significant either in my figures, but older horses tend to have more severe caries than younger horses do. And as I'll show in a moment here, that's potentially related to these areas, I think kind of as Travis mentioned, that they have these hypoplastic areas that then suddenly become exposed as the teeth normally wear. And then they become exposed to the oral cavity as these quite large defects that food directly impacts into then. So as far as a hypothesis is concerned, is what occurs and why these defects occur and why they matter, I propose that central linear defects, which are due to these vascular channels being patent, allow food impaction along the vascular channel, of course, but since it's such a small area, they form caries gradually that progress peripherally in the tooth. And this may never become significant if the cemental degradation is gradual enough. As well, cemental hypoplasia that exists at the apex, whether or not there's an occlusal surface defect, may become exposed when the tooth wears to that point, as we said. And then caries may form more quickly because the food may directly impact against either a very thin wall of cementum or abnormal cementum, or maybe even directly against the enamel of the tooth if the hypoplasia is complete in that area. And this may never form significant caries, though, still, if they're exposed later in life and the tooth has kind of walled itself off enough that it remains stable in the cementum of the periodontal complex. However, this is, I think, where we need to worry, and these are the kind of defects I think we need to worry about when they have a central linear defect plus this hypoplastic area, because it means that food may impact the whole way to the apex of the infundibulum before that large defect is ever even exposed. And so when that defect becomes exposed, the caries may already be quite severe. As far as further research and moving further into research and understanding why these defects occur at the apical aspect of the tooth, it really brings us to assessing the vasculature at the apical aspect of the tooth, especially in erupted teeth, because the current research only deals with unerupted teeth. So we need to understand how that vasculature works once the tooth has erupted. So to that effect, micro-CT was performed on 8 teeth selected to represent a variety of ages, but of course skewed towards a younger age group looking for those vessels. And the teeth were also picked if they were recognized to have defects on traditional CT. And then descriptive data was collected as far as that was concerned. Histology was then performed. So we performed histology on the same 8 teeth using the micro-CTs to direct us where to make our sections. And the vascular structure was then examined in detail in the infundibulae. As you can see here, the histology is great as far as assessing these central vascular channels and also finding tissue debris and feed material within the vascular channels and seeing these lateral branches which aren't visible on any sort of imaging. No matter how detailed these micro-CTs are, you still can't see those very small lateral branches. And you can also see the material impacted into them as well. All right, so as far as